Hi, I'm John Adams. My wife Sheila Adams. We're both health insurance agents. I'm also a licensed life insurance agent, and we have our office down in Roundup. We uh, we started this about 5 years ago. I retired at 63, and after a year and a half of retirement, I needed to find something to fill my time and help other people in the community. My son-in-law is a financial planner and insurance broker. And he's got several offices in Nevada, Montana, and a few other states. And he offered to help us get started so that we can help people in the area. If in Roundup where we're at, if anybody has any questions about health insurance, life insurance, they've got to go to Billings to talk to somebody. So we're convenient for them, and we meet a lot of wonderful people. So today I'm here to talk about health insurance through the marketplace plan, which is for those who are under 65 and families. So a marketplace plan is a health insurance plan based through the health insurance marketplace, a service that helps people shop for and enroll in health insurance. The marketplace is available in every state and is ran by the federal government in most states. Some states have their own marketplace, which may be different, have a different name. Well, in Montana, we use the federal one. So you've probably heard of Obamacare, and that probably wants you to just turn off the TV right there. But over the years, it's evolved. It's now called the Marketplace for Health Insurance. The federal government part of it is depending upon your income and your household size, they give you an opportunity to get what they call advanced tax credits to help you pay those premiums. So marketplace plans cover the essential benefits of prescription drugs, emergency services, hospitalization, laboratory services, mental health and substance abuse disorder services, and preventative health care. Free preventative health care. Health insurance companies want you to be healthy. So they want you to go in for your annual checkup, annual blood work and stuff to keep you healthy, because dollar wise, it's cheaper for them to keep you healthy than it is for them to let you get sick. So when applying for a marketplace plan, you provide information about your income and your household. You can use this information to determine if you qualify for premium tax credits, cost sharing reductions, or coverage through Medicaid or Children's Health Insurance Program in the Montana's called CHIP. Let's see. When choosing a marketplace plan, you consider your budget and healthcare needs. For example, well, these plans are based in metal tiers: bronze, silver, gold, and platinum. With a bronze plan, you may have lower pocket premiums, but you'll have higher out of pocket when you go see the doctor. Platinum plan, you pay more for your monthly premiums, but less when you go see the doctor. So hopefully there's a balance somewhere in there that fits your needs. When can we enroll? Right now we're in the middle of the open enrollment. And that's from November 1st to December 15th. If you enroll in that time period, your new insurance plan will start on January 1st. They do extend the open enrollment till January 15th, but then your plan wouldn't start till February 1st. After that, you can enroll if you qualify for a special enrollment period, and that's when you have a life event based on your income, or you've moved, you got married, you've had a baby. Any of those things are called life events, which allow you to have an open enrollment period, along with losing credible coverage. If you have coverage through your employer or your spouse's employer and you lose that coverage, that opens you up for an automatic special enrollment period where you can get one of these plans. These are all based on your income and your household size put against the federal poverty level. Just to throw some numbers out, for a single person, the federal poverty level for 2025 is $15,060. It's not a lot of money. They don't consider you at the federal poverty level unless you're making that much or less. And the insurance coverage is based on a percentage of that federal poverty level. 138%, 150%, 200%, up to 400%. If you're still making 400% of the federal poverty level, you still may qualify for health insurance, depending upon the size of your family. And you can always get a plan, but you might have to pay more of the premium. We have several clients in our area who are making what they consider a decent living, but based on the federal poverty level, they still qualify for a zero premium health insurance. These plans typically will cost for a family of four, husband, wife, and two children, about $1,300 a month. If your income falls in the right level, you'll get premium tax credits, could be up to $1,300, $1,400, $1,500 to where you won't have to pay anything for your health insurance. So someone who doesn't go through the marketplace and goes to Blue Cross Blue Shield and gets a plan, they have to pay the full amount, $1,300 and change. Through the marketplace, I can get you the same plan, maybe a zero premium, or maybe $100 or $200 a month, which is a lot better. And I can, when we meet with people individually, we go over those numbers with them. I use a thing called a quote through the marketplace program that what we have. We just throw your ages and your estimated income in and show you what's possible. If you like what you might see, then we can go into detail and do an application. But there are some caveats to that. If you get a marketplace plan and you get advanced tax credits to help pay for those premiums, you must file your taxes that year. And if you're married, you must file jointly unless you're legally separated or there are other extenuating circumstances. So a little more about health insurance. You probably heard the terms HMO, PPO, EPO, or POS. HMO is probably the most familiar one. That's a health management organization. They contract with providers. Providers are doctors, dentists, hospitals, clinics. If you go to their people in network, the insurance company will pay everything they say they're going to pay. If you go out of network on an HMO, they probably won't pay anything. A PPO, they still have a network. It's preferred provider organization. They still have a network, but it's a bigger network, and they will still pay some, if not all, out of it. So you can go to the doctor of your choice. And then there's exclusive provider organizations. Those are kind of a combination of the two. And then there's a point of service, which is the most flexible, but also typically more expensive. So an HMO is typically a lower premium. PPO is a little higher. You pay what you get. You pay for what you get. So if you want the best, you're going to pay a little more. In what we do, I tell people health insurance is bought two ways. You buy health insurance like you would car or homeowners insurance. You pay those premiums, hoping you never have to file. So you pay a low premium, but you're still covered if you fall out of the tree. The other way to look at it is, I'm not healthy. My family's not healthy. My family history is not healthy. I know I'm going to have to go to the doctor. I know I'm going to have to take medications. You might want to pay a little more upfront on your premiums, so you don't pay less when you do go see the doctor. So there's two ways to look at that. I mentioned cost savings reduction, CSRs. Through the marketplace, those are only given if you are in the silver plan. So like I said before, there's a bronze, silver, gold, and platinum plans, and each premiums go up as you jump tiers. But the silver plan will give you cost saving reductions. So on the screen is the accrual value. Typically, a bronze plan will pay 60% of your bill, you pay 40. Silver plan is 70%, you pay 30. Gold plan, 80-20. And a platinum plan, they pay 90, you pay 10. Or again, the premiums for that are a lot higher. And the cost share reductions, they go up. 73% is where you have to get a silver plan. And they do have some cost sharing reductions in the other categories. Cost sharing helps you with your co-payments and co-insurance. You need to know the difference between the two. Co-payment is a set dollar amount. If you have a co-insurance of $10 to see your primary care physician, you pay $10 no matter how big that bill is. If you have a 10% co-insurance to go see them, you pay 10% of that bill, no matter how big it is. So you think about it, the average doctor visit is probably about $85. That's just to see the doctor. So if you have insurance, you pay $10. If you had co-insurance, you'd pay $8.50. If it was 10%, 20%, $16.50. And that's how it works. I would like to know how much I'm gonna pay when I go in. I really like co-payments rather than co-insurance, but some plans, somewhere along the line, they're gonna throw a percentage in. And that typically will run into you when you get into your prescription drug portion of your plan. Generic drugs are usually free. The insurance company pays for those. You have preferred, you have specialty drugs in tier 3, 4, and 5, where they usually have a percentage there. You pay of the bill. Where we at, Chip? The next. So if you are a Medicare eligible, I just want to throw this out here. If you're 65 or older and need Medicare, or if you're under 65 and have been disabled for 24 months drawing Social Security, you qualify for Medicare. Medicare open enrollment is different. It's October 15th to December 7th. If you have a supplement plan, you need to get a drug plan. If you have an MAPD that's included in your plan, Medicare will throw two penalties out at you. If you do not get Part B, which is your medical part of it, Part A is your hospital part. If you don't get Part B when you're first eligible for it, you'll be penalized when you do go get it. And it's not just a one-time penalty. That's a penalty premium you have to pay for the rest of your life. So it's a good idea to get that. Same thing with the drug plan. I'll give you an example. My mom is now 92 years old. When she was 65, she didn't even take aspirin. Nothing. Well, by the time she hit about 73, she started having to take blood pressure medicines and some other stuff. So she got a prescription plan. Now she pays more in penalties because she went 7 years without it than she does in premiums. And it's for the rest of her life. So it's important to know when the start dates are, enrollment periods and everything, so you avoid those penalties. Okay. So tier formularies, I mentioned that before. Tier 1 is generic drugs. Tier 2 is preferred generic drugs. Tier 3 is name brand drugs that there's no generic for. Tier 4, 5, and 6 are for your specialty drugs. For most insurance companies, they've dropped off tier 6 and they've combined them with tier 5. Those are typically your chemotherapy type drugs, specialty drugs, and it doesn't seem fair. The sicker you are, the more you have to pay. But there's a percentage and it does work out. Most of these plans have a max out of pocket that you have to pay. So once you get to that point, then the insurance company pays everything. So that's another thing to look at when you're deciding what plan you premium, the deductions, the max out of pockets, and then how much you have to pay for certain things that happen in life. So I already mentioned HMOs, PPOs, EPOs, in-network, out-of-network. If your doctor is not considered in-network with your plan, you can ask your doctor to join that plan. So you may have that option. But you kind of search for your plan. Let's say you go to Billings Clinic for all your medications, all your provided stuff. You might want a Blue Cross Blue Shield plan because they are 100% in network. If you went to St. Vincent's or Intermountain Health, you might want to go with another plan. They do take Blue Cross Blue Shield as in network, but they don't take other insurances. So be careful with that and talk to your agent, and we can look up and see what doctors are available in network, what pharmacists and what other insurances are there for you. What do you got next? Co-pays, deductibles, co-insurance, and out-of-pocket maximums. I already mentioned co-pays. Co-pays are a set fee you pay for a service. $10, $15, $45, or whatever is set in your contract. Deductibles, that's what you need to meet before the insurance company pays the share that they promise you'd pay. Sometimes you'll get a deductible of maybe $4,000. You'll have to pay that $4,000 out of your pocket before the insurance company pays everything they're supposed to pay. Some of them do not require you to meet the copay for certain things, like a regular doctor visit. You pay $10 or $15 deductible or not. Some of them will require they'll pay 10% after you met your deductible. So important to read the fine print. Co-insurance, like I say, that's a percentage of whatever the bill is, and that's a percentage no matter how big the bill is. And then out-of-pocket maximums, or OOP. Uh, Insurance company might have an $8,500 max out of pocket for an individual, 16,000, 17,000 for a family. But once you reach that, the insurance company pays 100% of everything. So 95% of our clients never reach their max out. But it's good to have in case you need to have some specialty stuff done. I'm up for surgery, just for example. It's gonna be well over $100 and some thousand to have the surgery that they've got to do to me. That's well over my max out. So I'll pay my part up to that point, and then I won't have to pay anything else. So what does a broker do? We answer questions. And we help people get signed up. Some of the stuff is really confusing and it changes every year. So just to give an example, we as broker agents have to take 2 federal courses every year, one for Medicare and one for marketplace plans. Pass those courses, then that information is sent to each company that we are contracted for. Blue Cross Blue Shield, Mountain Co-op, Aetna, all these different, there's 9 or 10 of them that we're with. Each one of them also requires to take training with them to be certified to sell their products. So training usually starts about mid-July and we go, or actually mid-June, and we go usually till September before we're fully accredited with all of our companies. And that's an every year thing because the laws change every year. Just for an example, and for Medicare, so you don't fall into that, but there's a big change in Medicare prescription plans for 2025. They used to have what they call a donut hole. You pay up to $5,830 out of pocket for your medications. Once you got to that point, then you paid 25% until you reached catastrophic, which was $8,000. Now they've removed the donut hole and they've eliminated the catastrophic stage. They brought it all the way down to $2,000. So now you're in the initial stage till you reach 2,000. You don't pay any more for your medications after. So that's a good thing, but anytime you get a good thing from the government, they're taking something else away from somewhere else. So a lot of the insurance companies have adjusted their formularies. They've moved a few things back and forth. You still can get a decent plan, but they change things, and they change things every year. Some of the changes are good, some of them might not be good. How do we get paid? A broker, we're not paid by our clients. We get, in our case here, our boss pays most of all the overhead, gives us a small salary and a portion of the commissions, because he's got to make money too. So if I sell you a policy and the commission on that policy is $70, he's going to keep 60, I'm going to get $10. That's how I get paid. So it pays to be nice to your clients, so they keep you as an agent. And but our service is free. I mean, we'll come to talk to people for free, give them advice. I've helped a lot of people who have done things on their own through the computer, who made a little mistake and couldn't figure it out. They call me, we fix it for them. I'm not their agent because they did it by themselves, but I was able to help. And that, for us, that's what it's all about.
The phone number on there is wrong.
Yes, the phone number on there is incorrect. Our phone number is 406-426-2244. The number up there is actually my boss's phone number. So if you want to talk to Brent, that's fine. He's not only my boss, but he's my son. So why am I doing this? I retired at 63. I needed to get a plan like this because I wasn't old enough for Medicare. So I got a plan like this. And based on my income, which was projected just to be my Social Security, I qualified for a pretty good plan. The premiums were $1,009 a month. They paid the premiums. I was not aware at the time that if I took money out of my 401k to put in the driveway, to put in the septic tank and do a few other things, that would increase my adjusted gross income. So by the end of the year, my adjusted gross income was about 3 times what I told them. And they said, shame on you, we want our money back. So they wanted all 12,000 and change back at tax time. If you've ever dealt with the government for paying your back taxes, they throw premiums and penalties on top of you, interest and everything, and you'll never pay them. So I had to borrow $12,000 to pay that. So if I can help one person a year avoid that trap, that's what I'm gonna do. So if you get a plan, what happens if you, get another job, pays more money, still wanna keep your plan, but now your income's a lot? What do? Call John. John will say, let me redo your application, put that new money in there. Yeah, your premiums went up $30 a month, no surprises, tax time. So that's what we do. And a little more about Sheila and I. Uh, we also volunteer in Roundup at the senior center during the off insurance season, which is not during the open enrollments. And we do taxes for people and in the community. So we're doing it to help. We don't get paid for that. Like I said, I don't get paid for today. So we're just here to help folks get the best plan they can and they can afford. And you have a lot of options. All they have to do is give us a call. And we can either come out, we can do it over the phone, or they can come down to Roundup and there's several ways to do it. So that's about all I've got to share. Anybody have any questions? Do you have any questions?
So if my spouse, he has like health insurance available, so our main source, I guess, is through his company, but I know like with past positions, we've been like, he'll have health insurance and I would have the benefit available too, so we would have both
Mhm.
sources. I guess with the healthcare marketplace, if we wanted additional coverage, can we still?
You
go
can't
with
really
that?
get additional coverage. You really shouldn't have two plans.
Yeah.
But 2 years ago, the federal government says, if you have employer offered benefits, usually they're good for the employee, but to get your spouse and your children covered, you gotta pay an extra premium. Sometimes that premium, according to the government, is not affordable based on your income. So your household income, if that is over, I think it's 9.5%, if your premium offered to you is over that, you can get a marketplace. So here, what's your husband's name?
Jace.
Okay, so Jace has insurance through his company. You're offered the same insurance, but you gotta pay a high premium for it. No, he keeps his. You can get a marketplace plan for you and the kids. It's still based on his income and your incomes, household income, and if your kids are making money, that's included also. If you have your mother-in-law living with you and she has an income, that's included in your overall household. Even if they're not gonna be insured. So there's, it seems a little weird, but that's what they do. So yeah, you can get insurance through the marketplace for yourself and your kids. If your husband's insurance premiums on your part are what they consider unfair. If you do get a plan and you like it, every year it'll automatically renew. But it'll renew at what they project your income to change, and that plan might change. So if you don't contact your broker and say, hey, let's check and see what's available for next year, you could get stuck with a lot higher premium for the same plan you had before. So anytime your income changes, you have a life event, get married, have a baby, anything like that, let your broker or agent know. We can adjust your original application and it goes from that time forward. So what happened to me, with my insurance plan, had I known that when I took money out, my income changed, I could have called my broker and says, hey, I'm going to now make this much money for the rest of the year. He would have adjusted my application, my premiums would have gone up, but I wouldn't have had a surprise at tax time. So it's important to keep in touch with your broker agent. And that's what we're here for, is to help answer questions and give them the best plan they can, that they can afford. So, anything else? It doesn't take very long to go through the application process. And it is through the government marketplace. So what they are gonna take your name, your address, and your social security number, make sure that you are you and no one's stealing your information. You'll also find out at that time if somebody has and you didn't know. And then they'll take your income against the household, community you live in, they'll offer you plans and it's really pretty easy. But, well, it's easy for me because I do it every day. It may not be easy for you because you don't do it very often, so. But yeah, you have our cards, you've got our phone number, And you guys know how to get in touch with us if someone comes in and asks you questions. So, thank you, I guess. Anything else, Sheila?
Yeah, sounded great.
No, that was nice. Was.
Not everybody likes to stand up in front of people to talk. According to Sheila, I don't stop talking. So. She doesn't really like to stand up in front of people, but she's qualified or more qualified than I am. Yeah.